As we do celebrate Black History Month, we're focusing on the health of the African American community.
Incidents of racism can certainly leave you feeling sick, but studies show microaggressions are having a detrimental impact on physical health.
So our Noelani Graff, she's joining us now with this morning's Health Insider. And it was really interesting for you to dig into this with our Health Insiders.
Yeah, an interesting and eye-opening connection happening here. So we already know that the Black community is at a higher risk of heart disease. High blood pressure and high cholesterol are factors there, but also contributing is chronic stress and the physical impact of having to fend off those daggers of hate.
Collectively, as a society, we need to recognize systemic structural racism as a public health crisis.
Racism is a disease, and it is making the Black community sick, says ABC15 Health Insider Dr. Shad Marvasti.
So let's say you're someone who's being racially profiled or looked at in a certain way when you go into the store. These microaggressions actually impact the folks who are, who are experiencing it, many Black Americans, by actually causing an inflammatory response.
That inflammation is the root of the major diseases of our time. So that anger, that pain, even bracing for negativity is toxic stress that has a cellular impact.
Absolutely. It's increasing blood pressure. It's putting strain on the heart. It's putting strain on the brain. It's promoting insulin resistance, development of more weight or fat.
Further increasing the risk of diabetes, heart disease, and cancer, which African Americans are already prone to. Adding to the evidence, a new study from the American Journal of Psychiatry showing exposure to racism and toxic stress at an early age causes kids to develop less gray matter in the brain.
Part of our brain, which is responsible for almost everything, like our movement, our behavior, like all the different memory.
Setting kids up early on for bigger battles, which is why Dr. Shad says we have to fight as a community, not just against racism, but for equal access to care. So other things we can do collectively: be an ally, understand microaggressions and how to call them out. Representation matters at all levels to stop systemic racism. And then individually, as an African American, you've got to get your regular health screenings. Know your blood pressure levels, because that is a silent threat there. And then also go to therapy to help process the feelings of the impact of racism. We've got to start normalizing therapy for everybody.
So interesting, because these might be things that people just don't really take the time to realize, yes, this is a recognized problem. It's not just in your head, and there are resources there that we can change things.
Yep, absolutely.
All right, thanks, Nohe.